decided I wanted to come to Plymouth pretty much right after I came for my interview. There was kind of just a feeling I got when I got here.
Feel like I could see myself there and could interact with the faculty and the students kind of the way I wanted to. Feel like I really had a place and I wasn't just one of a number.
We have a class size total of 30 in our DPT program, and sometimes we meet with them in 2 sections. That's more of an interactive seminar kind of structure.
Courses, we do case-based exercises. We'll always give them examples to relate it to a case.
Our labs take place right in this room, and the students work in pairs.
We'll have 5 students lay down on the table and pretend they're the patient, and we'll have the other 5 pretend they're the therapist. And we'll run through that just so they get really comfortable so that when they can then go practice it in pro bono on real patients.
A lot of opportunity for our students to work in our pro bono clinic while they're here on campus.
I've had a great experience in the pro bono clinic. I've been able to see a lot of different conditions, a lot of patients.
And some of the more complex patients that I've seen were actually here at the pro bono clinic.
It really gets you ready to go out on clinical.
Their first full-time clinical education experience happens at the end of year 1. And they do 3 of those during the program.
My first placement was at an outpatient clinic really close to home. My CI was really great. He worked me in just at the pace that I really wanted. So at first I was doing a lot of observing, and then I started treating with him, and then by the end I was kind of treating on my own, and that was a really nice progression for me as my first clinical.
My inpatient rotation, I was on the neurodebility and brain injury team. So I saw a lot of strokes and traumatic brain injuries. Working with the neuro population just drew me in, and I loved absolutely every minute of this summer.
And then they come back to us and do some more classroom training, and they do more advanced training in their clinical education experiences during year 2 and year 3.
Any physical therapy program is gonna be difficult, and it was stressful, and I think having that community feel, everybody was there to support each other.
On our first day at Plymouth, Dr. Legacy told us that the competition was over and now's the time to work together and really use that to our advantage and become the best physical therapists we can be. And I think that really stuck with us. Our class especially, we got really close. We've gotten close with the other classes as well.
When they're in their first year, they have either a second-year student or a third-year student mentoring them. And when they're a second-year or third-year student, they get to act as mentors.
Kind of seeing that progression and looking back is really actually quite humbling, and it's really nice to think about.
It's really great for the older cohort, the mentor, to get experience mentoring a student so that when they graduate, they're really good at being a clinical instructor, so that hopefully in the future we can send our students to them.
Once they complete their studies, they apply for state licensure, and they have to pass a licensure examination.
They give you the tools, the resources, and again, the clinical experiences to succeed and really find what you want, what you love, and then go into it.
Got the full experience here. I feel ready, and I feel really excited to kind of see what comes next. And I know that when challenges come, I have what I need to really be successful.